Welcome to Western Wisconsin Journal. I'm Meg Heaton, and for many years, almost close to 30, I was a reporter with the Hudson Star Observer. And over that time, I've had many occasions to work with the people at CCH, either interviewing staff or talking with residents and telling their stories, or the many volunteers that pass through CCH every year. They're a vibrant part of the community. They continue to be that for the community. And we are curious, obviously, and concerned for the very unique challenges they face as we go through this COVID-19 pandemic. My guest today is Jennie Orman. She is the Director of Nursing at CCH. And we'd like to talk with her this afternoon about some of those challenges that they're facing. Welcome, Jennie. Thank you for being with us.
Thanks for having me.
Could you give us a little bit of your background and how you came to CCH?
Yeah, so I've been at CCH it'll be 15 years, the beginning of August. I actually started out here as a CNA. While I was in nursing school, I worked for a year as an LPN while I was getting my RN. So I was an RN, then a clinical nurse manager for a few years, and now I've been the Director of Nursing for 9 in October.
Wow. Did you ever think you'd be facing anything like this?
Absolutely not.
Yeah,
Never in my life.
Yeah. Did you, how many residents are there at Christian Community Home?
So we are licensed for 50. So we have a 50 bed capacity. We were running around mid 40s when this all started.
Okay. And how big is your staff?
We have about 150 staff members between nursing, dietary, all the departments.
Mm-hmm.
60 maybe.
And you have any idea how many volunteers?
Oh, a lot.
Yeah.
Just as many as staff, if not more.
Yes. It's a popular place.
Yes. We love the volunteers.
Oh, absolutely. Absolutely. I know Shelley does a great job and stuff. So could you tell us, how long have you actually been in, is it appropriate to use the word lockdown or?
Yeah, I mean, for lack of a better term, yeah, lockdown. So we actually started restricting visitors March 12th. So it's been 2.5 months. Yeah.
When you say restricting visitors, that's anybody from the outside?
So residents that are passing away, family members are allowed to come in and visit. Mm-hmm. So we have had a few visitors in since then.
But have you had any positive cases?
We have not. We haven't even had any residents that have needed a test. We haven't had anyone with symptoms.
That's great. That's great.
We've been fortunate.
Oh gosh, yes. How are the residents and their families reacting to all of this?
You know, everyone, that was a concern at first. It's like, oh goodness, we have to make all these phone calls and telling people they can't come see their loved ones. We were lucky enough that everyone was understanding and gracious about it. And, you know, they just know we're trying to take care of their loved ones. The longer it goes, the harder it does get. So everyone was understanding.
Yeah. How about for the staff? Because, you know, as I remember being up there, some of the CNAs who have so much direct contact with you, they tend to be kind of younger people like you were when you started. Yeah. It's got to be tough on them.
Yeah, it's a big change because we're not just doing the health aspect for them as the nursing staff. It's a lot more of the emotional support too, and sometimes the spiritual support too. So we're doing a lot more than just performing cares now.
Yeah. What kind of support is that? Can you describe what that means?
So they do more one-on-one visits with residents, sit and spend time with them. We do a lot of FaceTime with residents and their family members, so the staff are assisting with that. We can't do large group activities right now, so we're doing what we call hallway bingo, so the staff help out with that. Kind of, spend more time conversing with the residents and stuff like that.
Yeah. I would imagine they also kind of miss that physical touch that they would get from family members.
Yes, that's the hardest one, because even though we are here working with them, we're still trying to not have that physical contact as much as we could either, because we don't want to expose them to anything either.
Yeah. Do residents talk about it? Do they?
Some of them do, especially the ones that are more with it. In the beginning, there was a lot of people watching like the news stations all day long. So we kind of try to encourage them to put something else on because it can be a little depressing and grim to listen to all day. But yeah, there's people that know what's going on and they understand why we're doing what we're doing.
Mm-hmm. Mm-hmm. what are the precautions like inside there among the staff and for the residents?
Yep. So all staff have to wear a face mask anytime they're here. I'm in a room all by myself, so I took mine off so you guys could hear me well. So staff is wearing face masks at all times. Residents, when they're out of their rooms, are wearing face masks as well. We're encouraging them to stay in their rooms as much as possible, but that's not always able. So we do bring them, they do come out every once in a while. Residents that are coming in new from the hospital, because we still do need to bring in new residents because people still need care. They're put on a 14-day isolation precaution. So staff, when they go in those rooms, are gowning, gloving, having the face mask on and doing all of that.
And then, like I said, your staff, they go home to their families or do whatever. What kind of precautions are you having them take, or are they taking?
Yeah, so especially once the Safer at Home order went away, we met with all the staff and we said, yes, we know you can go out and about, but we as a facility are highly, highly encouraging all our staff to continue practicing the Safer at Home. Stay home as much as you can. If you do have to go to the grocery store or something, we gave all the staff members cloth face masks so they can have a mask to wear when they go out in public. So we're asking them to continue right now as if nothing has changed with the Safer at Home order.
And they're complying with all of that then?
From what we know, yes.
Yeah. So you mentioned earlier, there were always a lot of wonderful recreational activities that they did. And I'm assuming most of those are not happening right now.
Right. So we do, like I said, hallway bingo. We do, our chaplain is doing kind of a room-to-room church service instead of having the big church services out in our atrium. Do a lot of one-on-one, like out in the gardens, especially in this nice weather. We'll take residents one at a time with a staff member. We're trying to do some hallway sing-along and stuff like that. So, we're trying to get creative and come up with things that we can do and yet social distance still.
Are you concerned at all about their kind of mental health, either, the level of mental health during this period?
Both the residents and the staff. This is a tolling time on everyone, and especially for our population here that has dementia and doesn't really understand what's going on, and just all of a sudden their family's not here. So to step up the best we can and help them communicate with their family via Skype, Zoom, FaceTime, phone calls. We're doing what we can to keep them intact.
And you do have a memory care unit as well?
Yep. In our assisted living, we have a memory care unit.
Okay. How about meals? Are they all inside or in their rooms?
There are some residents that come out to the main dining room because there are people that need assistance with eating. And so we talked to the state and we are able to have a few residents at the time in the main dining room. We disinfect everything in between seatings, but the majority of the residents are getting room trays and eating in their rooms.
Okay. What about testing? Is there a plan to test the residents and the staff?
Yep. So earlier this month, the governor came out and said their goal is to test every nursing home resident and employee. So we're working on that. We've got our testing supplies. We're contacting all the residents and their family members and also the staff. And our plan is to next week start doing that testing.
Oh, okay. And then in terms of the staff, are they putting in additional hours, or do you have enough staff to cover everything? Or?
So we've been fortunate so far that we have enough staff to cover. With the hospital stopping to do elective surgeries during all this, our census did kind of come down. So that helps with staffing. And so with colleges not being open for in-person, a lot of our college students, our temp seasonal people that work during the summer are back now. So we've had a good pool to pick from.
I guess, yeah, a lot of people. Well, we all know that the CNAs are critically important at a place like this.
Yes, they are.
Yeah.
Yes.
Yeah. So you mentioned the chaplain. He's still making the rounds and.
Yep, he does one-on-one visits here at CCH, and he also is going over to Pine Ridge and Wintergreen, and he is seeing people in all buildings.
All buildings. Is there anything that you are running across that surprises you about this that you didn't? I mean, other than the whole thing is a shock, I get that, but that you've learned in terms of either your staff or the residents in terms of the work that you've done for so many years.
Yeah, so kind of like I said before, we were worried how everyone was going to handle this, and we thought there was going to be a lot of anger towards us because it's not our choice to do this. I mean, we're just doing what we have to keep the residents safe, and just everyone has been so accepting and helpful and reaching out, and we had probably 1,000 masks donated to us, like cloth ones that people have made, and just the community outreach. And it's been amazing. Everyone that has chipped in and helped out, and just how good people actually are.
Yeah, that is good to hear. Yeah, it is a good community that way, and they've always been good with CCH. In terms of what you anticipate going forward, what are your biggest challenges going forward, do you think?
So the biggest challenge, I think, is just kind of how to open up and when to open up for visitors and all that. We do get guidance from both CMS, so at the federal level, and Department of Health Services at the state level. So just kind of working with those guidelines and everything, and just opening back up. And then also that anxiety and fear of, oh my gosh, once we do open back up, possibly, bringing it in. And it's just very anxiety inducing.
Yeah. So how you sleeping?
Well, I slept pretty good last night because I forgot about this until I got to work. And I was like, oh, it's a good thing I didn't remember, because I probably slept it all last night.
Oh, well, you're doing a good job. It's no problem at all. There have been a lot of concerns from people about the opening the state up the way it did so fast and without too much guidance originally. Is that a concern of yours as well, and with your staff?
Oh, very much so. We can tell our staff all we want, that we really want them to practice safer at home, but we're not going home with them. So I can't guarantee that they're not running errands without a mask or out and about. The first weekend it opened up, I had to drive through downtown Hudson, and my heart just stopped. I was like, I shouldn't have done this. There were so many people, and it's just, it was so stressful. And we're doing what we can, and we can encourage everyone to follow the rules. But like I said, we're not with people 24 hours a day.
No, and they're young people who've been cooped up for a long time, and it's,
I know.
It's
so
understandable.
I keep being like, okay, guys, remember, you want to go to the gym, but maybe just do that workout at home. So
yeah, exactly. Yeah, no, I understand. In terms of the operation that you do there, and how tight knit the staff is, I think it's always been a very tight knit group.
Yeah.
What is there something you'd like people to understand that they might not realize about the work that you guys are doing, particularly right now?
I think the big thing is that we all care about these residents. They become our family, so that our staff isn't just here for the paycheck. They're here because they truly care about the residents, and we're doing the best we can, and we're trying to keep them healthy and keep them happy. So just we're doing what we can.
Do you have any idea about when the guidelines will change in terms of letting people in or out?
No, Medicare put some suggestions out last week to the state. So Medicare within the last week and the federal government kind of backed away and said, okay, now it's up to the states. We're not doing anything federally anymore. But here's what we would recommend. So they did send out some things to the departments of health, and has like this step down, kind of like the Badger bounce back plan, but just like, here's level 1 when we think you could do this, and kind of step by step. And a lot of it revolved around testing, the ability to test staff evidence, and then also just cases in the community. So like if cases go down and we open back up, but if cases start coming back up, what they're recommending is locking back down or starting to visit again. I hate using the word lockdown. It sounds so bad.
I know, but it's kind of what it is. Yeah.
Right.
And you said that testing will start next week?
Yep.
And that'll be both staff and resident?
Yep, so staff and resident. It's not mandatory, so people can say no, but we are highly encouraging everyone to do it. And then if they test positive, for residents, we were fortunate enough to have the space where we have one wing that we emptied out, and we're calling it our COVID wing. So we have a spot to put our positive residents, so they're away from the rest of the population. And then for staff, just based off of CDC guidelines, they have to be off of work for 10 days. So that was one of the stresses of doing all this testing too, is that we're testing all our staff at once, and there's people that are asymptomatic positive right now. So here's also this much staff that is out for 10 days. So then the staffing gets to be a challenge, but we're hoping that we're all negatives.
Yeah. Did you have any kind of a plan in place in the event that this happened?
So yeah, we were within the last few years, Medicare and CMS had this big thing called the Mega Rule where they were updating rules of participation. So we did have to develop an emergency preparedness plan. So we had stuff in place, and we had to go through and rate what our possible emergencies were. So like an internet failure, power failure, blizzards, biohazard was one of those. So, I mean, we had some stuff, but we never thought we'd be using it.
Yeah, no, I can't imagine either. Before I let you go today, is there some advice or some reassurance that you would like to give people whose family members are in not just CCH, but any long-term care facility?
Yeah, I think just, we're all here for the residents. One of the things we hear sometimes is that, I talked to my mom, she's so sad, but you know what, their spirits are hanging in there. We have residents that are, they got smiling faces on, they're trying to buddy up and take care of each other too. So I think just everyone's hanging in there, and, we're here for the residents.
Oh, that's terrific. Well, thank you so much for being with us, Jenny. We wish you all the best, and hopefully everything stays not positive.
Right?
The one time when not being positive is a good thing.
It all to be negative, yes.
All right. Thanks again, Jenny.
Yeah, you're very welcome.
All right.